Good morning, everybody. My name is Florence and I'm the HCPC Professional Liaison Consultant for Northern Ireland. Alongside me today is Stephen Battles. He's the Head of Policy at the General Osteopathic Council, and we've partnered with them today to bring you this event. Thank you so much for joining us. We know how busy you all are. Now, just before we start, I'd like to just take you through some of the housekeeping to help you get the most out of our time together today. So you'll see on the screen there, a copy of the slides will be shared, so you don't need to be scribbling away frantically. And of course, due to the large numbers, the microphones and the cameras are turned off. You're probably used to that by now. We would ask you to use the reaction buttons though, because we do want a bit of interaction if possible. You will be prompted to do so as well, but feel free to use those at any time. And you can post questions as well on the Q&A. Rather than raising your hand, please use that Q&A function. We do have a small team there of moderators, and they will try to get to as many as we can, but we will develop a fuller FAQ to cover the ones that we might miss. There will be opportunities to vote as well, so please use your mobile phones when you're prompted to do that as well. Now, the voting is anonymous, so you can be very honest, but that really provides us with some very helpful feedback, so please do that. And again, we'll share the results of those with you afterwards as well. Now, we're using PowerPoint Live. Some of you may be more familiar with that than others, but it means you can go back and forward to a slide if that's what you wish to do. So maybe if you switched off for a moment without realising you need to go back and see what that was all about, you can do that, and it doesn't affect anybody else. And the links are also live, so you can be directed to other resources immediately as well. Now, we know you all love to get a certificate, but we have no certificates for participation at all. We don't need those in the HCPC, but we would prefer maybe that you complete a short reflective piece afterwards. And if you want, you could save a copy of your voting to help you with this as well. You can see there what our agenda is for today. The content for the webinar really was guided by the questions that you shared with us. We had conversations with many different stakeholders just in preparation for today, and that has helped us with the content. So people like professional bodies, registrants, academics, strategic leaders, and many, many more have helped us. Now, the HCPC is the regulator for 15 different professions, and we work alongside other regulators, including the General Osteopathic Council, and that is to regulate a broad range of professions, including those who are under the umbrella of allied health professionals, AHPs, biomedical scientists, clinical scientists, practitioner psychologists, and hearing aid dispensers. As regulators, our role is established by statute, so that's an Act of Parliament, and in our case, this is the Health Professions Order 2001 and the Osteopaths Act 1993. Now, the orders clearly set out that our overriding objective is to protect the public. And of course, the public is all of us. Now, also on this slide here, you can see the values of the HCPC and the GOsC, which side by side demonstrate the commonalities in the way that we go about our work. So I'd like to introduce you to Stephen here now, Stephen from the GOsC. He's going to provide you with an overview of some of the work that we do as regulators. Thank you, Stephen.
Thanks, Florence. So on this slide, you'll see the key function of regulators such as HCPC and the General Osteopathic Council. So we take action to protect the public, including via fitness to practice and dealing with concerns and complaints about registrants. We quality assure education and training programs, maintain and develop standards, and publish a register of those who are allowed to practice in the UK. We also provide sessions like this one today, getting involved further upstream to support registrants to use our standards in practice. And therefore, regulators also work in a preventive capacity to support registrants and those who manage them. And then this gives us greater opportunities to influence, collaborate, and support our stakeholders and registrants. So with that in mind, we're going to hand over to Steph, who will lead us through the rest of the session today. She'll introduce herself shortly. Steph was brought in to work on the project as a clinical fellow and to use her knowledge and skills as an HCPC registrant to support this work. So over to you, Steph.
Thank you, Stephen, and thank you, Florence. And welcome, everyone. My name's Steph. I'll be taking you through the rest of the webinar today. By way of introduction, I've been a registrant since 1997, when I qualified as an occupational therapist. And I want to share with you a bit about my scope of practice so far and my experiences of supervision and delegation. My identity sits within my profession, but I also see myself as an allied health professional and a member of the broader healthcare workforce, and a workforce that extends across many sectors. My scope of practice, like a river, has taken many twists and turns as I've gained different experiences in my career so far. I started off working clinically, and I chose to specialise in neurology and neurosciences, advancing in my career with additional master's level education within the specialty. I supported the learning of others, including supervising students on their placements. I supervised and managed a small team, and I delegated to and supervised assistants, technicians, and other registrants. I engaged with service development, audit, and research activities that were the right size for the various roles and job titles I had during that time. We'll come on to the 4 pillars of practice in a bit. I subsequently chose to divert my career river and appropriately widen my scope of practice with a move into higher education, which also enabled me to further my knowledge and skills through PhD level education. Since 2016, I've taken several roles with a specific focus on learning and workforce development, including for my professional body, this role with my regulator, and also as an independent contractor. I'm still an occupational therapist, an AHP. I don't use the phrase one by background, as my professional knowledge and skills still foreground the work that I do, albeit in a very different way to my first hospital roles. So that's a bit about who I am and my scope of practice and experience, some experience of supervision so far. I was going to ask you to test the react buttons, but I'm delighted to see you're already doing. But if you would just like, if you haven't used them before, you'll see at the top you've got raise and then you've got react. If you the smiley face. So if you click on that and give me a thumbs up or a reaction, everybody feels comfortable to use them. That's lovely. Thank you. It makes such a difference when you're presenting in a large room full of people you can't see. So thank you very much. Okay, this session, what we're going to cover, we've got an hour together. I've chunked it up. We've got voting along the way. The session will provide an overview of what the standards say in relation to delegation and supervision to support safe, productive and effective practice and career growth across the workforce. So we're going to be looking at the concepts of delegation and supervision in terms of you as an advanced practitioner or as an experienced practitioner, what you delegate and how you supervise others. But as we're speaking, also think about how things are delegated to you and how you engage in your own supervision as well. We're going to critically explore the key concepts and terms used within the UK context. There's sometimes subtle differences across the UK countries linked to delegation and supervision. We're also going to share with you links to relevant resources. As Florence said, those links are live, so if you want to quickly grab anything and open it up in a separate browser, you can do so. If not, and that feels like too much multitasking for 9:30 on a morning, the slides will be coming out to you and you'll have access to everything there. What we're keen to do is to provide space for you to consider your own responses to delegation and supervision, including in relation to the support workforce and others. And in a good outcome-focused way, like the registrants we all are, we're going to invite you to identify a small action to be completed within the next 2 weeks based on the learning and the thinking that you've gained from today. As we go through our session today, please bear in mind the definition of service user is a broad phrase. So it includes all those who use or are affected by the services of you as professionals. So this shows that as registrants, we serve a wide range of people, including but not limited to people accessing services for their health, such as patients, carers, families, and people living with health conditions. Service users also means the people that we manage, the people we supervise, the people we delegate to, learners and students we support, research participants in our studies, system leaders, colleagues in the same profession, colleagues who work in different regulated professions, and other colleagues, including those who are not regulated to or not required to register with a regulator. and many more. So I'd like us to hold this definition in mind as we move on and talk about key concepts in this webinar. Now, this concept is arguably quite a complex one, so I'm going to start with it first, and then we'll move on to supervision and delegation. This is about different levels of practice. I'm going to share with you the key messages I'd like you to take away from this slide, and then we'll talk about them in more detail. There's 5 key messages. 1, there are different levels of practice, which encompass many different roles across sectors as we advance in our careers, through experience and sometimes with additional qualifications. So you'll see we have supportive, assistive, entry, enhanced, advanced consultant, and our pre-entry colleagues as well. Delegation and supervision runs through all of them. Second is supervision does not necessarily mean from one person at the level of practice above. Equally, delegation does not necessarily mean to one person at a level below. The third point is that HCPC and GOsC registrants are considered autonomous at the point of registration. The fourth point is that autonomy must be seen as freedom within a regulatory framework, and for those of you in substantive posts, within organisational structures and governance. We must work within the limits of our knowledge and skills and our job descriptions for those within organisations, and know when to refer to others. And this impacts on what can be delegated to other people. HCPC and GOsC do not set additional standards for each level of practice, and public safety, public protection and professional credibility run as central themes regardless of the level of practice and employment status, and safe delegation and effective supervision act as supportive mechanisms. So I appreciate there's quite a lot within that slide, but we're going to explore it in a bit more detail. We need to acknowledge, first of all, that these definitions of levels of practice have come from the health part of our sector, so may sound unfamiliar to people attending today who work in social care, local authority, private sector, justice sector, the many places where we work. However, many professional body frameworks across all sectors and UK nations have now adopted a version of these levels of practice in their language. The key point here is that many job titles can be enacted at different levels. The jobs will also vary in their associated pay bands and spine points. We've received this question quite often in preparation for today, but from a regulatory perspective, there's not an explicit relationship between a level of practice and a specific pay band. While I appreciate this is a common and valid source of concern, issues of pay, terms and working conditions sit beyond the remit of the regulators. You might hear the phrase advanced levels of practice. And that refers to the 3 distinct but overlapping levels. So in England and Wales, these are enhanced, advanced consultant. In Scotland and Northern Ireland, the levels are referred to as specialist, advanced consultant. This webinar is focusing on delegation and supervision by you, registrants who are more experienced and throughout these advanced levels of practice. And like I said, also supervision and what is delegated to you. As registrants, we move through these different levels of practice and we become equipped to manage increasing levels of complexity, uncertainty and risk in our work. This requires time, experience and in some instances additional qualifications. The important point to make here is we don't gain our place on the register and start working the next day in advanced roles. At all times throughout our careers, we must ensure we are working within our knowledge, skills and experience. And that's our individual as well as professional knowledge, skills and experiences. Identifying areas for growth to support our continuing professional development, all based on the needs of our service users. So as I said earlier, all people who are registered with the HCPC and GOsC are deemed autonomous practitioners at the point of entry to the workforce. This means that autonomy is a key feature at all career levels rather than a defining feature of one. At the advanced and consultant levels of practice, registrants are exercising significant levels of autonomy, judgment and responsibility and are managing high levels of complexity in your roles. At all times, we remain responsible for our decisions and actions, including when we decide to refer on, when we decide to delegate, and when to respect service user autonomy too. There is sometimes confusion with specific advanced roles versus this concept of advanced levels of practice. For example, the role that is named Advanced Clinical Practitioner can sometimes be conflated with the entire advanced level of practice, but the former, ACP, Advanced Clinical Practitioner, is a role within the level, while the advanced level of practice can be enacted in many different roles across sectors and settings with many different job titles. As I said, as healthcare regulators, HCPC and GOsC do not require additional regulation for each level of practice. The exceptions are for additional activities which generally are regulated by law, for example, prescribing. It's a matter for the government to decide which professions can and can't prescribe, and lobbying from professional bodies, not regulators, can influence this. Registrants with prescribing rights are required to undertake an HCPC approved qualification, comply with the HCPC standards for prescribing, and have this activity annotated on the register to recognise it is within their individual and professional scope of practice. This will obviously also impact on what they can and can't delegate. There are frameworks, including those from the professional bodies. For example, this diagram was taken from the Dietetic Career Development Framework, which can help to inform and guide practitioners through these levels of practice. And these frameworks can be used in supervision, and I know they are already used in supervision and in appraisal processes and equivalent. So we're nearly there with this slide. I promise the rest aren't quite as long, but I just wanted to get our foundation understanding in place. So to recap, when we refer to advanced levels of practice, it is not in any way restricted to one specific role, but applies to all practitioners in whatever context. For example, an experienced podiatrist in private practice, an occupational therapist working as an expert witness in medico-legal work, or an advanced speech and language therapist in a prison. All HCPC and GOsC registrants are autonomous at the point of registration, and all of us must work within the limits of our knowledge and skills, and where appropriate, job descriptions. And finally, HCPC and GOsC do not set additional regulatory standards for each level of practice. For the webinar today, it's important to emphasise that supervision and delegation run through each level of practice. Now, I appreciate there that I have thrown an enormous amount of information your way, so I'd just like you to use the reaction button at this point. If you could give me thumbs up if that all sits comfortably, or use any other reaction that best describes how you might be feeling. Thank you. Brilliant. Appreciate that. So what we're going to do, we're going to talk about delegation, and then we're going to talk about supervision and bring them back together at the end. The HCPC regulates individual registrants like the GOsC as well. Therefore, we must appreciate the standards speak directly to them. These are the standards for delegation. You must only delegate work to someone who has the knowledge, skills and experience needed to carry it out safely and effectively. You must continue to provide appropriate supervision and support to those you delegate work to. And I think that encapsulates the interrelationship between delegation and supervision. So you'll note from the standards that there isn't a specific list of delegated activities from the perspective of the regulator. Some organisations may choose to provide more guidance and something closer to a list of delegated activities, and this is part of organisational governance and something you may wish to consider exploring if you felt you needed to. These standards must be interpreted within a broader context. HCPC sets standards for registrants, but the responsibility to meet them requires support, and we're doing a series of these webinars with managers and strategic leaders as well to guide them through applying the standards and supporting you as registrants to use them. So by that I mean the obligations do not lie solely with the registrant, the person who's doing the delegation to another person. If delegation occurs within organisations, then employers, including service managers and strategic leaders, also have a responsibility to support safe and effective delegation through local organisational policies and processes, to support supervision and delegation, as set out in example in the CQC regulatory framework. Equally, the person being delegated to, and that may include you when you're getting asked with delegated activities, has the responsibility to make a judgment on whether they feel able to accept the delegated activity. And I appreciate that this is sometimes a challenge, and we'll come on to that in a moment. If you are delegating to another registrant, the activities must be based within the individual and profession scope of practice alongside their job description. If you are delegating to a support worker or a carer, they must feel confident. Everyone must feel confident, but in the context of the support worker, they must feel confident that the delegated activity sits within their job description and individual capabilities. Now, it's the latter example in particular where we need to be mindful of power dynamics. We must support everybody to feel comfortable and able to say if they do not feel confident with the activity that's being delegated to them. As a colleague said to me recently, delegation should be seen as a relational activity rather than a transactional one, and I particularly like that. It's an ongoing process where we provide support and receive support for the activities that are delegated. Sometimes a service user needs to be referred on, and this is different to delegation. Referring on means you have recognised that there is a need for another professional required to support a service user within their scope of practice and beyond yours. At that point, when you refer on, as we know, they will take on the responsibility once the referral has been accepted. With delegation, the responsibility remains with the registrant who is delegating part of the required intervention to others, and it should be done so without undue pressure. And that is encapsulated in the GOsC practice standards. There's a common themes here around providing professional support, adequate resources, people not feeling under pressure, and all the things that are wrapped around delegation as this relational activity. We're exploring delegation first and then supervision, like I said, but it's important to recognise that identifying the supervision and delegation requirements within the team, and also who and how to delegate, must be determined by the needs of the people we serve. And while it's beyond the scope of this webinar, it must also be appreciated that the same can be said for skill mix and service design. It's also important to remember the relationship between supervision and delegation, as we've spoken about. For example, sometimes you may need to use your supervision space to explore your professional judgment, to be able to articulate that narrative when making decisions about who and what to delegate within the context of your organisational policies and processes. And in this example, supervision is an essential space to enhance safe and effective delegation, and it allows you that opportunity to articulate your professional judgment, to have that narrative clear as to why you are choosing to delegate, and actually capture some of that decision making process formally in supervision notes should you ever be required to use it in the future. So when it comes to delegation, there's some key points for us to consider. And these have come from the understanding the challenges within the system and from all the engagement work we've done with colleagues in the professional bodies and the wider workforce leading up to this session today. The key points to take away: delegation is a core component of maintaining safe, productive and efficient practice. It is a mutual legal duty between the employer, person delegating and the person being delegated to. Active learning and continuing professional development is required to support safe and efficient delegation, including when we delegate to others and when we are being delegated to. We know there are some registrants who are also delegating activities to people outside of their organisation, for example, care workers. We'll come on to that in a moment. And remembering there may be unseen power dynamics in the delegation process, and these need to be considered. So we're going to look at some practical strategies and some ideas that people are already using in practice. Delegation enables everyone to work efficiently, to optimise their scope at every level of practice. So within aspects of health and education, this framework is already used. The idea of universal, targeted and specialist. I know that occupational therapists and speech and language therapists already use this to identify levels of intervention that are delegated to different groups within the professions. Skilled, trained and supervised assistants and technicians tend to focus on the universal interventions. And then this enables the regulated professionals to focus on working with people with more complex interventions and populations as well. So I was recently at an event, and some of you may be there as well, hosted by Skills for Care, and there was a case study example at the event, a physiotherapist in Scotland, and she was describing the work her team does to support people with learning disabilities by working with carers and other workers at the local day centres. And they work with the carers and the support workers to delegate universal activities such as practicing walking with a new mobility aid, foundation level exercises and things that they can put into the service user's day to keep them active and keep them moving. And it was such an impressive story. The delegation process was a continual cycle because this is delegating across sectors as well. And it was very much based on effective working relationships. The day centre staff and the carers knew how to contact the physiotherapy team if they had concerns. There was regular re-evaluation and a process for training new staff too, appreciating the turnover was quite high. Here's a worked example from over a decade ago. This was taken in 2014, showing how podiatry and chiropody divide activities with different levels of complexity. So you'll see here you've got your qualified, your specialist, your advanced practitioner doing different levels of complex work and delegating them across the different levels of practice for regulated professions. There were many diagrams that we could have chosen, but I wanted to share this one with you because it's over 10 years old. And this shows that delegation is not a new concept, although we have to appreciate the language around it may have evolved. The 4 pillars of practice are clinical practice, facilitating leadership, learning, leadership, evidence, research and development. So this slide shares the version from NHS Education Scotland. And again, there is some variation in the terminology used in different spaces. So, for example, the Royal College of Occupational Therapists use the term professional practice to recognise their members work in many non-clinical settings, including prisons, social care, leisure centres, schools and so on. It's important to say that the 4 pillars of practice are not compulsory from a regulator's perspective, but from a workforce perspective, they can act as a guide when thinking about optimising your scope of practice to support your professional development to benefit the people you serve, but also what you may want to delegate to optimise the scope of practice for others. So on this slide, I appreciate it's a little bit busy, but you'll see a worked example. This is taken from a guide published by the British Association of Prosthetists and Orthotists, highlighting some of the delegated activities and roles already undertaken by support workers and technicians in patient-facing roles. So you'll see under clinical and technical practice, you've got support workers running their own delegated clinics, undertaking telephone reviews. They know when to refer on. They're supporting patients and families through providing information. They're also, from an education perspective, working as assistant supervisors for pre-registration learners and undertaking promotional activities to promote the profession. They're providing leadership and management through onboarding and induction support for new staff and line management for the workshop teams. When it comes to evidence, research and development, the support workers and technicians in patient-facing roles are taking patient evaluations, they're contributing to audits and service evaluation, contributing to quality improvement projects and analysing data, including outcome measures. And I just think this is a lovely worked example of what can be done. And I can see from the reactions that many other people feel the same. So thank you for that. So think about how you can use the 4 pillars, think about how you can use the universal targeted specialist as structures when you're thinking about what you can and can't delegate. The key point in our discussion here is that delegation requires professional reasoning, and it's an ongoing process. And you can keep coming back to this slide later on. This slide shows an example of a professional reasoning process to support the decision to delegate. It's from the British Dietetic Association, and please go to your own professional bodies to have a look at what they've got on delegation too, because there are many resources to address the nuances within the individual professions, but also have a look at what the other professions are saying as well. Look out for these profession-specific resources. So you'll see there's questions to consider, and again, you can use these when you're being delegated to. You can use these when you are delegating to others, but at a system level, at an organisational level, you can also ask the same questions of managers. Is the delegation in the best interest of the service user? Questions about job roles, education and training. Are competencies aligned to this particular activity that you're delegating? What are the policies in place? Is there regular support? And once you've gone through this process, is it still in the best interest of the service user? And again, you can use these questions and you can document them in supervision to show that narrative process that you've been through when you are making judgments on what to delegate. Okay, that's enough for me for now. So we're going to just pause and ask you to vote. We're going to move on to issues of insurance and governance, but I'd like to hear from you first. So there are a selection of statements accessed via this QR code or on the link on the screen or in the Q&A. I'd be grateful if you could give us your immediate thoughts to these. Also, please add any questions in the chat if you have whilst we're here. And then once you're done, if you could give me a thumbs up reaction so I know to move on. Thank you. I can't tell you how nice it is to have these reaction buttons. Please use them in other meetings as well. Okay, so we'll move on. So we've discussed delegation, and as we've already discussed, when it comes to delegation, the person doing the delegating retains the responsibility. But that responsibility, as we've said, does not solely sit with you as an individual if you're in a contracted employment. So organisations, employers also hold liability for the actions of their employees in the course of their employment. Important in this discussion is that organisations hold vicarious liability so long as the employee has acted within their scope of practice and contract of employment. Now, it's a whole hour's topic and beyond in itself in terms of professional indemnity insurance and vicarious liability. But the questions that I shared earlier, that flow chart, could provide you with a structure for your professional judgment and reasoning as you're working through your decision-making process around delegation. And again, do look at what professional bodies have in relation to delegation as well to support the workforce. Take time if you're also in employment with an organisation to understand what the governance and local policy arrangements are within your place of work. And we talk about this more as well in the companion webinar on scope of practice. If you haven't already joined us, we'll share details of that later. So we know that we have professional indemnity assurance, and then the employer has vicarious liability. By way of example, my scope of practice has grown, my individual scope of practice has grown, so it extends beyond what is traditional for an occupational therapist. That doesn't mean I'm going off doing anything wild and dangerous, but it does mean that I've needed to take out my own professional indemnity insurance to make sure all of my work is covered. And it's just being clear about what is and what isn't covered. And with regards to your professional indemnity insurance, a lot of that is also offered by the professional body and is covered in your fees for those of you who are members. Before we move on to supervision, I'd just like to grab your understanding and your thoughts specifically about delegation and insurance. So there's a selection of statements accessed via the QR code. If you could just please share your thoughts here, add any other questions you might have in the Q&A function, and give me a thumbs up when we're ready. Thank you. The reason we're asking these questions is obviously we're interested in the answers, but also the second part of this project is going to be to develop resources and signpost to existing resources. So it's really helpful to us to get all of these views from you, because then it will help direct the next phase of the project. So we will be looking at every individual vote, we'll be looking at every individual question, and that's going to help form what the next phase of the project looks like. So thank you for your contributions. Okay, so for the rest of the webinar, we're going to look at supervision. I'm going to start with the key points to consider. The first thing I want to say is supervision is not a nice thing to have. It's a mechanism for safe and effective practice in every setting and every sector. We're going to talk about different types of supervision, and appreciating, just like with delegation, we don't come out of university or through our apprenticeship routes knowing and feeling fully confident in how to be a supervisor and how to be a supervisee, and also how to delegate. There's active learning and CPD activities required around these spaces so we can be effective in these roles. We're also going to consider that some registrants may be supervised by people from outside of their origin profession, and acknowledge that supervision is at different levels of cultural maturity within different professions. So whilst there's no single or agreed definition of supervision, at its core, supervision is a process of professional learning and development that enables individuals to reflect on and develop their knowledge, skills and competence through agreed and regular support with another professional. The HCPC standards of proficiency state the need for active participation in supervision to support high standards of practice, alongside a requirement to work in partnership, for example as a supervisor or supervisee, for the benefit of service users and carers. And remember again that broad definition of service users. Equally, the GOsC standards reinforce the responsibilities of registrants to ensure that staff are provided with professional support and are managed effectively. And we've already discussed how supervision is an integral part of this. Engaging in any form of supervision can form part of your CPD activities, so long as you show the impact it has on developing your practice. So if you can capture some of that in your supervision processes, then that is useful information that you can add when it comes to registration renewal. Different types, we know there are different types of supervision, and think about the ones that you've experienced. It can include remote supervision, which is especially relevant for our registrants in remote and rural settings. Cross-profession supervision, multiple supervisors for different aspects of work, line management supervision, education-based supervision. So this could be for pre-reg learners, but also post-reg learners, including as they're moving into advanced roles. There may be moments in your career where you are engaging in educational supervision as you move through from one level of practice to another, as part of a formal structured programme within higher education. For example, enhanced or trainee advanced practitioner to advanced practitioner. So in these instances, you may have an educational supervisor at the university and a work-based supervisor who works in collaboration to support your growth. Or you may be engaged in supervision for broader professional development as well. My own experiences of supervision have been wide and varied. I currently have line management supervision within this role provided by HCPC. I also choose to pay for remote supervision with an experienced strategic healthcare professional as part of my broader growth and professional development. This is the first time I've worked for the regulator, so I felt that I just needed that extra supervisory scaffolding from someone who sits outside of the organisation as well. So I arranged that for myself for the duration of this project. As an occupational therapist, I've been supervised by more experienced colleagues within my profession and beyond it. I had a separate dissertation supervisor for my master's dissertation, who was a psychologist, 2 supervisors for my PhD, one was a physio, one was an occupational therapist. Alongside this role, I work in a freelance capacity, so I engage in regular peer supervision with colleagues to support my practice. They're just my examples. In short, the type of professional support, including supervision and other forms, are dependent on what you feel you need as individual registrants, alongside the policies and processes within an organisation for those of you who work in them. These supervision acts, as I've said, as an essential mechanism for safe and effective practice. And that's safety and effectiveness for your service users, but also to keep yourself safe. During the process of developing this work, I had a fantastic conversation where someone said, we contain so many other people's worlds and challenges that we need a container ourselves. And I see supervision very much as a personal container. It does feel like the right space in the webinar to briefly outline what supervision is not, but also recognise the validity of other forms of professional support. So supervision is not preceptorship. That's structured support, pastoral support as you're moving in a transition, either when you're new or you're coming in as an international recruit, or you're moving from one level of practice to another. It's not induction or onboarding, it's not probation, and it's not mentoring, and it's not counselling. Now, it's important to understand the different mechanisms of support, including so you remain within your own scope of practice as a supervisor. So there may be techniques that you use within your own supervision that come from the mentoring world or the coaching or the counselling professions, but these are separate roles and professions. And I know there are people on the call who will have extra qualifications to recognise themselves as coaches. And also counselling is beyond the scope of practice for a supervisor. And I wouldn't wander into that world because it is beyond my scope. This doesn't mean that the additional needs of someone you support are ignored. Your role as a supervisor in this situation would to be advise and refer on or suggest referral on if necessary. Research commissioned by HCPC from Newcastle University identified 10 key characteristics for effective supervision. I'm not going to read them all off the screen, you'll have the slides, but it's really helpful to use this as a structure. These characteristics can help us as experienced practitioners as we reflect on our current experiences and identify ongoing areas for development. And you'll see in these key characteristics choice where possible, understanding of the purpose, making sure it's regular, using supervision models, protecting time, number 7, which I know is a challenge, and it's been a challenge for decades across the system. Training and feedback for supervisors, I'm going to highlight that one because there is something around what can we do to support people to be effective supervisors as well as effective supervisees. So please take a look in detail if that's something that you think would be helpful for your work. Now, different professions approach supervision in different ways, and different professions are at a different place with the development of supervision. So, for example, drama therapists engage in supervision throughout their pre-registration course. There is further postgraduate training available in order for them to be recognised as a supervisor. And for drama therapists, they can feature, once qualified, with additional credentials on the directory held by the professional body. The point here is not to assume that uni-professional workplace supervision practices will map neatly to the learning needs of multi-professional advanced practitioners. Each profession is as I said at the start, each profession is at a different level of cultural maturity with supervision. But we must make sure that employers have appropriate supervision arrangements in place, that supervisors have access to learning and development opportunities, that the advanced practice workforce and business planning includes the provision of supervision, and that it's invested in. I'd like to share two things that can happen within the context of supervision and delegation. They are frequently asked questions, and I think they perpetuate as myths. Do give me a reaction to this if you recognise these as myths within your own worlds. The first one is a registrant can supervise or manage someone in a different profession and the same grade, and you can delegate tasks that on the face of it sit beyond a traditional scope of practice for a profession if that individual has the experience, additional training and qualifications. Yeah, these are perpetuating myths that do the rounds. And thank you for validating that, because I've heard it a lot in the conversations that we've had in preparation for today. Let's pick up the first one. A registrant can acquire the relevant skills and experience to supervise others. As I've shared with you, I've been supervised by many different professionals. Clearly, this is dependent on the nature of the activity. But if, for example, a psychologist is engaged in managerial oversight and has undertaken training, there is no reason they can't manage a multidisciplinary team. That's distinct from providing clinical supervision or supervising activities outside of the registrant's scope of practice. But the registrant equally does not have to be equal or lower grade of the professional they may be supervising. The second point, you can delegate tasks. Providing a registrant has the requisite skills and experience, they can be delegated tasks outside of their traditional specific profession. Registrants may develop additional skills through their own personal and professional CPD and their advanced level training and experience that can be transferable to wider aspects of their employment. So, for example, a paramedic may take an additional qualification in leadership and management. As discussed in the companion webinar on scope of practice, there are occasions where the individual scope of practice for us as experienced practitioners extends beyond the traditional boundaries of our professions. Now, this has to be done with oversight, additional learning and or qualifications, because sometimes when we say that, we do feel a bit of a reaction. We're not saying people will just run off wild and free, but an individual scope of practice can extend beyond the traditional boundaries, but must have oversight. And again, we're going back to this narrative of you being able to articulate the judgment and evidence why you can do something. So I'd like to dismantle those myths. This is the last vote. I'd like to hear from you again. So if you could answer these selection of statements. Please also use this time to put any questions in the chat. I know the team will get to as many as they can. What we're keen to is to get all of your questions so we can do a summary of good answers across a range. So if we don't get to all of them, that's probably unrealistic with the numbers we've got today, but we will definitely be looking at and responding to them later. So a few thumbs up, people have finished that, thank you. Okay, we're coming to the end of our time. We will not be overrunning. Here's some profession-specific resources and multi-professional resources to support you. It is only a selection. I'm really sorry if you can't see something from your own in here. I have tried to weave as many professions as I can through the delivery of the content. Most of these resources discuss delegation or supervision, including to the support work. There are also resources to support workplace supervision for advanced practice. Click on any of the links if you want to take them now. They will be coming around in the slides afterwards. I'm going to move us on, but you can navigate back to that slide if I've gone too quick. As we wrap up, we really want to hear from you. So this is our final plea. To help us understand the impact of the webinar, but also to shape phase 2 of this project. Please can you provide us with an initial response to these questions and then share with us one action point, and it can be tiny. I'd much rather it was really small and doable for the next 2 weeks rather than something massive. It might be to have a conversation with someone. It might be just to take 15 minutes to read something or to look at your professional body, but can you just share one action point that you can put in your diary and you can ring fence 15 minutes of your time to do within the next fortnight? Whilst you're doing these, also please post any final questions. And thumbs up when you're ready. Thank you. I've mentioned the companion webinar a couple of times this morning, so a reminder that this webinar is part of a series. This is our second one, so we're warming up nicely. We've got some for registrants and some for managers. The link to book on other sessions is being posted in the Q&A. It's available on the website. If you found this useful and you would like to share with other colleagues, please do. There is still some room on some of the others. We've had a phenomenal response. We've had over 5,000 people register for these, but we're greedy. There's room for more, so please do share. We'll be repeating this one. We'll be repeating the understanding scope of practice one, the companion one for you, on the 22nd of October. If you hadn't come across that but feel now you've been here, that would be useful. And also share with your managers and strategic leaders. We'll be running, it's the same, it is a very similar slide deck, but the narrative is slanted towards people who are in management and strategic level and leadership roles. So please do share those widely. If you would like to contact your regulator with specific questions about broader things, here are the key contacts for HCPC and GOsC. Again, you'll be getting those in the slide deck as well. So next steps, we'll be sending you a copy of the slides and a summary of the voting quite soon. Notice I haven't said a specific time, but quite quickly after this session. We'll ask you for some follow-up feedback. So if you're thinking of, oh, I'd like that, we need to signpost to this resource, or that bit wasn't quite discussed enough, we can use your feedback again for the second part of this work. And like I said, the second part of the project is to develop resources with a completion date of spring next year. So we can plug some of those gaps and we can signpost to the myriad of existing resources that there already are. But I'd just like to say thank you for making the time today and for all your contributions and for all of the reactions, which as a presenter has meant a lot to me as well. And I hope you enjoy the rest of your day. Thank you very much. Bye-bye.